femur.
So femur, it is a variety of
Long bone.
It is the largest bone.
Yes, ma'am.
Okay, and it is a bone of the thigh. Now, most of the time here is a question. Suppose this is a femur. This is a bone of आप बोलते हो lower limb, कोई बोलता है leg, कोई बोलता है foot. This the exact point is it is a bone of thigh. You should know the division of the body. This is head and neck. This is upper limb. Upper limb has arm, forearm, and hand.
Yes, ma'am.
Same with the lower limb. It has thigh, leg, and foot. So if you have tibia and fibula, then you should tell them it is a bone of leg. Leg में दो bone है. Tibia and fibula. Then you should know about it. Which is medial and which is lateral. Tibia is medially, so at the point of identification of the bone, you can say this is a bone of medial bone of the
leg.
And fibula, it is a lateral bone of the leg. इस तरह से बोलना है, ठीक है? So this is the femur. Again, this is a paired bone, so you should know the points for the side determination. The side determination, long bone has two ends. So it has two ends. This middle structure is called as the shaft.
Medial shaft.
Clear? Now, for identification of the side determination, you should know upper end, lower end with one point. Then you should know which one is anterior and which one is posterior. That is the second point. Then you should know which one is medial and which one is lateral. Clear? So for the upper and lower, you will see it has this rounded ball-like structure which is called as the head of femur. So this head of femur, it should always directed upwardly. So at the upper end of the femur, it has only one rounded ball-like structure which is called as the head. Now when you will see the lower end, it has two rounded bony ends. So that is the lower end. Clear? And these two bony, round bony surfaces, they are called as the condyles. अगर ये मैच कर रहा है, okay. So these are the two condyles, two rounded end for the lower end, one round end for the upper end. Upper end has a rounded end which is called as the head. Lower end has two rounded ends, they are called as the condyles. So two condyles is downwardly and the head it is directed upwardly. Now for medial and lateral, okay, the direction of this head, it should always directed medially because it has to articulate with the acetabulum, okay, which is on the lateral surface of the hip bone. So that's why it has to directed medially. So you will see the head is directed medially. Then anterior and posterior. For anterior and posterior, you will see the feature of the shaft. Okay, you can see the shaft of the femur. It is convex anteriorly and concave posteriorly. So the convex border of the shaft, the convex margin of the shaft, it should always directed anteriorly. The convexity of the shaft, it is anteriorly. Concavity of the shaft, it is posteriorly. Clear? Now there is one more identification for anterior and posterior. In the posterior border, posteriorly we have this well demarcated border. This is the posterior border. Okay, so it is always directed posteriorly. So let's find out कौन सी side का है, upper and lower end, head and two condyles. Okay, head is medially.
Yes, ma'am.
यहाँ के लिए भी करोगे तो all the points are same. Upper end, lower end, head is medially. Now we are left with one point. If we have identified that point, then we will come to know the side of the bone. For that, तो अब आ रहा है 1 घंटे बाद बेटा है कि कुछ पढ़ाया है नहीं पढ़ाया, जा भाई जा. Okay, now you will follow the third point, that is for the anterior and posterior. You can see the convex border, convexity of the shaft, it is directed anteriorly, and this shaft border it is directed posteriorly. If you will do it like this, so for this hand, this point is wrong. क्या हो गया? Sharpest border it comes anteriorly and convexity it is directed posteriorly. So this is wrong here.
Opposite हो गया.
You will hold it
Opposite side.
Yes, so this is the bone of the right side. So ये हम क्या convex अब क्या chemical points are clear. Main point, all the points for side determinations are clear.
Ma'am, anterior posterior.
Ahmed, you have any doubt?
Ma'am.
मैम इतने आप ये बता दो वाइवा में जैसे क्या क्या जैसे स्पोर्टिंग होगी और
देखो स्पॉटिंग होगा in front of you. The first point is for the identification and type of bone. You will identify this is the femur and this is the long bone. Okay. Side determination के लिए भी point आ सकता है. Then define the side of this bone. Right or left you will write according to the points. Okay. Then second question, it is related to the bony feature. Like it has this greater trochanter. The muscles attached to it.
Lesser tubercle.
There is a line which is intertrochanteric line or intertrochanteric crest. This posterior border. So it will be marked with any color.
मैम अभी हम लोग वहाँ थे मैम कि अपोजिट हैंड में पकड़ते हैं तो वो चेंज हो जाता है एंटीरियर पोस्टीरियर
लाइन
हाँ
Yeah.
मैम अगर जो सेम हैंड में पकड़ते हैं राइट में पकड़ते हैं लेफ्ट में पकड़ते हैं बॉर्डर्स मैम बॉर्डर स्विच हो जाता है मैम
किसके लिए बोल रहे हो?
इसके लिए मैम
मैम ये बॉर्डर्स इंफीरियर लेना चाहिए
राइट साइड का है ना
बेटा head is directed medially.
Yes, ma'am.
Okay. Head is directed upwardly. Condyles are inferiorly. इसके लिए भी करोगे तो यही point है.
मीडियली
Medially हो गया but
ये हाँ ये
तीसरा point follow नहीं कर रहा है ना?
Yes, ma'am.
You have to see all the points. They should follow the points for anatomy. Sorry, side determination. तो अब मैं इसमें पकड़ लिया posterior border गया ना पीछे.
यस मैम यही बता रहा चेंज हो जाता है थर्ड पॉइंट मैम ये मैं पूछ रहा था
साहब change
कौन सी साइड की
change कैसे
ये
हो
लेफ्ट
जाएगा?
लेफ्ट है मैम लेफ्ट है
ये लेफ्ट है
यस मैम
पक्का
राइट है.
सोच लो
लेफ्ट है लेफ्ट है
ये राइट है
लेफ्ट है मैम लेफ्ट है
उल्टा पकड़ेगा
इट्स अ लेफ्ट हेड ऑफ यू फिगर देखो ना कहाँ जा रहा है
मैम राइट है.
राइट है मैम राइट है भाई राइट हैंड में वो बॉर्डर उसके पीछे जा रहा है ना
हेड जो है वो भी यहाँ पर और भी तो पॉइंट
रुक जाओ भाई
सर राइट
कैसे मैम
हाँ ये यहाँ पटेला का
मैम ऐसे भी आप कह सकते हैं ना पोस्टीरियर कॉनकेविटी नहीं है जिसमें सी
यही
शेप
सारी
बनता
चीजें
है
हैं
तो कॉनकेविटी में सी नहीं बन रहा है तो पोस्टीरियर
उठाओ राइट साइड
मुँह जो है वो
गलती से लेफ्ट साइड को उठा लिया उसको राइट घुमा दिया
एक मिनट
है ना हमारे साथ हुआ है भाई
हाँ मैम और
ठीक है तो समझ में आया. इसीलिए 3 पॉइंट्स बता रही हूँ मैं.
यस मैम
श्वेता
अभी हम खुद कंफ्यूज हो गए
ये कंफ्यूजन होता है सबको होता है. That's why मैं कह रही हूँ ना you have to follow 3 points which end up upwardly, which is directed downwardly, which is medial.
यस मैम
चुप हो
6 महीने में एक बार मेरे अंदर रिसर्च में
Inspired wow.
नीचे वाले कॉन्डाइल्स होंगे
Okay.
वो कॉन्डाइल्स
And for anterior and posterior, you will see the convexity of the shaft. It is anteriorly, concavity is posteriorly. And अगर ये point याद नहीं रहता है, so you can follow this point. This is the
पोस्टीरियर
posterior border, which is always directed posteriorly. This prominent border, and there is a specific name is given to this border, which is linea aspera.
Linea
what is the
aspera.
name of this border?
लीनिया एस्परा
And it is present in the middle 1/3 of the posterior surface of the shaft of femur. Okay, you cannot find it here and here, only in the middle 1/3 part. So this is linea aspera. It is always directed posteriorly. Clear?
यस मैम यस मैम
Confusion तो नहीं होगा.
समझ
दो बोन्स को नहीं, आप सिंगल बोन पे भी आपको
समझ
सारे
गए मैम.
पॉइंट्स देखने हैं. हेड इज डायरेक्टेड अपवर्डली,
Medial.
condyles डायरेक्टेड डाउनवर्डली. इधर भी पकड़ते हो तो भी हेड अपवर्डली, condyles डाउनवर्डली. हेड इज मीडियली, इधर भी पकड़ोगे मीडियली. बट व्हेन यू विल फॉलो द थर्ड पॉइंट, दैट लीनिया एस्परा पॉइंट, यू विल सी here this point is
पोस्टीरियर
anteriorly, but
ये वहाँ posterior जा रहा है
हम posterior. This is the posterior border. ठीक है?
या
Look, these are condyles entirely. Entirely the lower end is made up of condyles. But you can see this gap is here between the condyle, intercondylar fossa or notch. It is always directed anteriorly, posteriorly, which is more deep. If you will see anteriorly here, between the two condyles, this gap is shallow. It is not deep as this.
Yes,
Okay.
ma'am.
तो the intercondylar notch, it is always directed posteriorly. So if you will come to know about the features of the bone, no, you can follow so many points for the side determination. Clear?
Yes, ma'am.
But these are the basic points. Is it clear to everyone?
Yes, ma'am.
Now we will start with the bony features. So this is upper end, this is lower end. Okay, upper end has this rounded ball-like structure which is called as head. Just posterior inferior to head, there is a constricted part which is called as the
Neck.
Okay. Now posterior to the neck at the upper end, we have two elevations here, two prominent
Elevation.
Yes. So these are called as the
Greater
trochanter. Like, you know, what is the meaning of trochanter, tubercle, tuberosity?
Yes, ma'am.
These are the terms used for any kind of rounded elevation on the bone. Clear? So this is a greater trochanter which is large in size, and this is the
Lesser trochanter.
If you will see the position of this greater and lesser trochanter, so this lesser trochanter, it is posterior medially and it is anterior laterally. Okay, greater trochanter and lesser trochanter. Clear? Now at the junction of this upper end and the shaft, just posterior to neck, we have two lines are extending here. Okay,
yes,
here is a line which is at the junction of neck and the shaft anteriorly. This is called as the intertrochanteric line. Ye wala. Okay, and posteriorly it is sharp, so it is called as the intertrochanteric crest. Clear? So these are the demarcation points for neck and the shaft. So between the neck and the shaft, anteriorly we have intertrochanteric line and posteriorly we have intertrochanteric crest. इसको दिए हैं सारे. किसी को ये नहीं आया है ना, तुझे पता था ना कि लास्ट में मैंने बोली मेरे पीछे बेटा गर्मी सबको लगती है, बट आप कहीं एक ऐसी जगह पर जहाँ पे आपको रूल फॉलो करते हैं ना, तो रहना पड़ेगा. ठीक है. So this is intertrochanteric line and this is intertrochanteric crest. Now you will see at the upper end of this greater trochanter, here is this pointed end which is called as the apex of the greater trochanter. Okay.
Apex.
So this is apex of greater trochanter. Here is a muscle attached to it. Okay. तो ये याद रखना है.
Apex.
Then just below the apex there is a groove. Okay. ये वाला. तो इस groove को भी याद रखना. Now what happened, this is the head. In the center of this head, which is not, that depression is not here in this bone. This is a admin bone. Okay. There is a depression over here which is called as the fovea. You will see the diagram, this fovea in the diagram. Yes. Yeah. This is fovea. Okay. So this fovea is giving attachment to a ligament which is called as the ligament of head of femur. So that ligament, it will help your head of femur to hold in the acetabulum. Okay, because
मैम ये उसके एसिटाबुलम के अंदर होगा ना मैम.
हाँ, तो उसके अंदर रखने के लिए कुछ तो सपोर्ट
हाँ,
चाहिए.
ligament.
That is ligament of head of femur. Okay, it will support the head of femur within the acetabular cavity. Clear? Now this is the shaft. Upper end is clear.
Yes, ma'am.
Head, neck,
Two
greater
lines.
trochanter,
Lesser trochanter.
Greater is somewhat pedunculaur and it has this pointed end upwardly and posteriorly
Apex.
apex. Then it has this
Lesser
lesser
trochanter.
Then just inferior to this
Fossa.
apex, on its medial side it has a fossa,
Fossa.
which is for the attachment of a muscle. Okay.
Two
Then-
lines.
huh?
Two lines.
Then it has two lines at the junction of the neck and shaft, anteriorly and posteriorly. The fossa and notch. Fossa, it is a shallow one. Okay. Notch, it is a deep, which has a deeper groove. Okay. And there is one more thing. Groove. Yes, somewhat elongated and again notch-like
मैम एक
structure.
डिफरेंस
This
और
is
बताना.
notch.
Yes, ma'am.
This is notch. ऐसे कर रहे हो. This is
Groove. Yes, ma'am.
Okay, and this is fossa.
Fossa.
Shallow plate
मैम
like जो होता है.
नॉच जो है वो साइड
हो गया. अब
नॉच जो होता है वो मैम वो साइड में होता है मैम. साइड नॉच
मार्जिन होंगे ना,
मार्जिन्स होता है और ये सब
यू शेप जो है दैट इज
यस और ये ग्रूव्स वगैरह ये
कौन सा ये
हाँ फोसा
देखो कैसा है,
फोसा
फोर साइड बाउंडेड है ना, इस तरह से है,
यस मैम
लाइक दिस, तो फोसा हो जाएगा शैलो प्लेट के जैसे.
यस
Okay, now we will come to the shaft of the femur. The shaft of the femur, it has borders, medial border,
यस मैम
okay, and it has lateral border and well
Posterior.
prominent, which is the posterior border. Medial and lateral border, they are ill-defined. But how you can define the medial and lateral border? You will start tracing the medial and lateral border from the lower end. Okay, so that is the point where you can only find the border. Otherwise, in upper part they are ill-defined. Now between the borders, it has surfaces. This is anterior surface entirely.
posterior
Between the medial and the
lateral.
posterior border, we have medial surface. Between the lateral and the posterior border, we have the
Lateral
surface. Clear?
पोस्टर पीछे
Posterior, lateral and posterior medial. Posterior surface नहीं है इसमें.
Yes, ma'am.
Posterior केवल border है.
लाइन
ओके, अगर इसमें एंटीरियर बॉर्डर होता, लेटरल एंड मीडियल बॉर्डर होता, तो एंटीरियर सरफेस नहीं होता.
यस
क्या होता? मीडियल, लेटरल एंड पोस्टीरियर
Posterior.
सरफेस. बट इट हैज़ पोस्टीरियर बॉर्डर, सो इट हैज़ पोस्टीरियो लेटरल, पोस्टीरियो मीडियल एंड एंटीरियर सरफेस. क्लियर? एंटीरियर सरफेस, इट इज एंटायरली स्मूथ. ओके, बट मसल्स अटैच टू दिस सरफेस, they will take origin from the greater and lesser trochanter. Now coming to the posterior surface, posterior border of the
femur.
And we will divide this posterior surface entirely into three parts. Middle 1/3,
यस मैम शाफ्ट
upper
अपर
and lower.
लोअर
Okay, middle 1/3, upper 1/3 and lower
1/3.
In middle 1/3 there is a shaft border which is called as the linea aspera. Okay, now you can see again, this is not that sharp border but most prominent border here. So you can see it has two border lines here, one is on this side and one is on that
Lateral side.
Okay, so medial lip and lateral lip of the linea aspera. Now when this border, we will trace this border upwardly, these two, you will see these two lips, they are diverging here. One is going laterally, one is going medially. The one which is going medially, it will continue with this line. There is a line which is not so prominent here, that is called as the spiral line. And laterally, it will continue with this elevation. देख रहे हो?
Yes, ma'am.
This is called as the gluteal tuberosity, this border. So this is the femur. ये posterior वाला part हो गया. It has a border in the midline.
यस
Okay.
मैम लेमिन
This is the linea aspera. It has two lips, medial and lateral lip of linea aspera. Here the head and either upper lateral. Now in the upper 1/3, both the borders they will diverge here. Okay, medial and lateral lip. The medial lip will continue with the spiral line and the lateral lip will continue with the gluteal tuberosity. Clear? So like this, in the upper part we have upper part of the shaft, upper 1/3 of the shaft. How many surfaces we can have?
Two.
Four.
Yes ma'am.
One is anterior,
पोस्टीरियर
lateral, medial, and this is the posterior surface which is called as the gluteal surface.
यस मैम
Clear? Same happens with the lower 1/3. This medial and lateral lip, they will diverge like this and they will continue with the medial and lateral condyles, and these margins here they are called as the medial supracondylar line and lateral supracondylar line. Like this, on the inferior end of the shaft of the femur we have again four surfaces: anterior, medial, anterior, lateral, medial, and this is posterior, but this posterior surface is called as the popliteal surface here.
पॉपुलेटियर
Popliteal याद रहेगा, because with the name of this popliteal, behind the knee joint we have a diamond shaped fossa which is called as the popliteal fossa. जैसे cubital fossa पढ़ा था, ऐसे ही यहाँ पे popliteal fossa होता है which is here at this
टिबिया
point.
फिबुला आगे
Clear?
बढ़ता हो
So this is about the posterior border of the femur. Posterior border of the femur is important. पूछा जाता है वाइवा में कि explain the posterior border of the femur. So in the middle 1/3 the posterior border is called as the linea aspera, which has two border. medial and lateral. Medial and lateral lip at the upper end, they will diverge, and medially it will go towards the lesser trochanter, which will continue with the spiral line. Laterally it will go towards the greater trochanter, and it will continue with the gluteal tuberosity. Okay. At the lower end, again medial and lateral lip, they will go towards the corresponding condyles, and they will continue with the supracondylar lines. Okay, so these borders here, just above the supracondylar condyles, they are called as the supracondylar line. Medially, medial supracondylar, laterally, lateral. And between these two lines, we have this triangular space, which is called as the popliteal fossa. Is it clear now?
Yes, ma'am.
Now coming to the lower end of the femur, it has two condyles, medial and lateral. So without seeing the position of the head, how you can identify the medial and the lateral condyle? Lateral condyle is somewhat flattened, and medial condyle is more rounded or convex. बड़ा है size में, this is smaller in size. Okay, these are the medial and lateral condyles of the femur. Now these medial and lateral condyle of femur, they have a space between them. Anteriorly, this gap, it is shallow, and this gap, it is giving attachment to the, it is articulated with the patella here. Okay, so that's why this surface is called as the patellar surface. Posteriorly, we have a deep notch between the two condyles, which is called as the intercondylar notch or groove. और क्या बोला था मैंने? Intercondylar fossa, है ना? Deep one है. So, or the inferior surface of these condyles, that will articulate with the corresponding condyles of the tibia, and it will form your knee joint. Okay. So if you have a question, joint form at the femur. Hip joint.
Tibia femur joint. Patella.
Patellofemoral joint. Okay. And then इधर ये क्या हो जाएगा?
Tibiofemoral joint.
Which is called as the tibiofemoral
joint.
Okay. So this is about the femur. Okay. तो इसमें बता दूँ मैं आपको the points that is important. Greater trochanter, lesser trochanter, linea aspera is important. Okay.
Posterior side.
Now there is one more thing. This is the medial condyle. Okay. This is the medial supracondylar ridge. This medial supracondylar ridge, when it meets with the medial condyle, and there will be an elevation appear here, this is called as the adductor tubercle. Again, this is an important landmark. Okay? The adductor tubercle, it is always on the medial condyle. Adductor means towards the midline, and where it is directed, posterior-medially. It is superior to the medial condyle, and but it is directed posterior-medially. And this adductor tubercle is again very, very important because the muscle is attached to it. So adductor tubercle, lesser trochanter, linea aspera, gluteal tuberosity, this one, which is at the lateral base of the this linea aspera, when it will go towards. This is very simple. In the midline, it is a single border which has two lips. Both lips, when they will go upwardly and downwardly, they will diverge. Upwardly, medially, whatever spiral line, laterally, gluteal tuberosity. Okay, inferiorly, medially, medial supracondylar ridge, laterally, lateral supracondylar ridge. There is a space between them, which is called as the popliteal surface. Clear? Yes, ma'am.